Hi, I'm Dr. Singhania and I'm going to talk about how a child with behavior and educational problems should be assessed. Now, the goals of assessment is that you need to look at all the aspects that can affect the child. You have to look for differential diagnosis, comorbid diagnosis, and to look at the family situation to be able to help and support them. Just to identify things which can affect attention and behavior. For example, attention can be affected by the language, even if the person is speaking English, the accent, the tone of the voice, if the child is suffering from hunger, fatigue, depression, anxiety, particularly sleep deprivation, or not able to understand the language adequately. This can all result in inattention. And what are the factors affecting behavior? If the child is having problem with friends, if the child is having difficulty with academics, even mild dyslexia can cause significant behavioral problems. If the child is having problems at home like marital conflicts or bullying by a sibling, again depression, hunger, fatigue, anxiety, and inappropriate child management. So when you do an assessment, you want to help the student. It's not a label, but it's looking for the strong points as well as to determine the needs. And the assessment would include ability levels like intellectual ability, achievement levels in academics, language, social competence, emotional status, and the child's environment. And the goals are to find the right placement, to make an accommodation or adaptation in the classroom, to help the teacher form an IEP if that's necessary, to decide on medication, type, dose, etc., and to follow up. It's very important to remember that ADHD or all those are not checklist diagnoses. It's not just using tests. It's very important to collect information from the child, from the parent, and from the school. And comorbid conditions must be assessed for. It's very important to talk to the child, however old or young the child is, because what the child information can give us is crucial. Getting information from parents using behavior checklists, getting information from school using standardized behavioral checklists, all these are very important. There are many tests we use. We use intelligence tests, you use language tests, ability tests, emotional status of the child, you use computer tests to look for attention. But remember, test is not evaluation. Evaluation is putting everything together and most importantly, talking to the child. Unfortunately, we don't have tests which can apply to all cultures and all countries. So it's good to select appropriate tests, note the norms, and note cultural or ethnic limitations. And that information should be put in the report as well. And we always use confidential limits, which means there's no one score, it's a range of a score. So I hope this gives you an idea of how comprehensive an assessment should be before diagnosing a behavioral problem in the child. You have to look at parents' managing abilities, the child's language problems or learning problems, or the environment in the school for bullying, whatever. Thank you.